Oklahoma's unemployment rate of 5.1% is one of the lowest in the nation. The economy has boomed during the recession and post-recession years. And according to Oklahoma State University economist Dan Rickman, the state can expect to see more job growth this year. But a recent national Gallup poll indicates Oklahoma is not faring well when it comes to individual well-being. The Gallup Healthways Index measured things like emotional and physical health, life evaluation, and work environments, and ranked Oklahoma the 9th worst state in the nation for well-being. It found the cause is a familiar and persistent problem: poverty.
Year after year, study after study, we hear the same news. Oklahoma is ranked one of the highest states for obesity and among the highest states for smoking, related illnesses and deaths, and overall health. Oklahoma is also ranked one of the highest states for infant mortality. The new Gallup Healthways Well-Being Index shows Oklahoma is ranked 9th worst in the nation for overall well-being. The poll indicates Oklahoma is 5th worst for healthy behavior, 6th worst for physical health, 10th worst for life evaluation, and 11th worst for emotional health.
I think it's picking up on a lot of the financial stress that Oklahomans are under. I think that mental health and well-being are tied to the stability and security you feel in your day-to-day life.
Kate Ritchie is an analyst for the Oklahoma Policy Institute. She says the Gallup findings are not surprising because while some people in the state are prospering, many aren't. Oklahoma's poverty rate is nearly 16%, well above the national average of 13.2%.
When people feel financially insecure, no matter how hard they work, it takes a toll on your optimism. It takes a toll on your outlook on life, how satisfied you are with your life when you work a 40-hour-a-week job and you still can't buy health care for your kids, or you still can't get by without food stamps.
When it comes to poor health rankings, Ritchie says individual choices like smoking may be a contributing factor, but by and large, it has to do with the environments in which people live. This Oklahoma City neighborhood is illustrative of that. Many can't afford to drive a car, and there is no grocery store within walking distance. Corner convenience stores serve as the alternative.
We have a lot of overweight kids, and we don't have enough grocery stores. All we have is places where we can get snacks and stuff, like unhealthy food. We need a grocery store that we can get salads and healthy fruits and vegetables and stuff.
That's all they have around here is just corner stores and a bunch of places where bad people can go and just get beer and stuff. It's not a good neighborhood.
Many other neighborhoods, communities, and cities across the state face similar circumstances.
A lot of households that don't have access to a grocery store, that do not have working major kitchen appliances. So if you don't have a fridge or a stove to make this healthy food on and you can't get to a grocery store to make it, then that behavior for you is not something that is as independent as someone else who does have access to those things.
Ritchie says the lack of public transportation further isolates the poor because people can't get to a grocery store or to a job. Finding affordable housing is another reason people can't get out of the cycle of poverty. Research done by the city of Bartlesville shows there is not enough housing for the working poor, and that has led to homelessness. This apartment complex is set up to reverse that. It's called Pathway Housing.
One of the criteria is that you have a job. And the idea behind this particular program is that you would stay here rent-free, utility-free, for up to at least a minimum of a year.
Melissa Jenkins is the coordinator for the Washington County Wellness Coalition. She says fresh food is delivered to residents twice a week. To supplement their meals, the complex also has a food pantry filled with non-perishable items. The goal is to have residents save as much money as they can while living here.
The group that was in last year, they saved a total of $31,000 collectively. We thought that was pretty exciting to see them save that amount of money.
Jenkins says the money is used by residents to transition to paying for their own housing. She adds one couple even had a down payment for a house. Oklahoma City is also making strides to reduce homelessness. 2 years ago, the Homeless Alliance opened this day center where 300 people a day come to get a reprieve from life on the streets. People have access to computers, they can take showers, receive hot meals, get medical help, and access services to help them get back on their feet. Just 2 months ago, the Homeless Alliance began implementing the Housing First model already being used in Tulsa.
What Tulsa has taught us is that it's unreasonable for us as a community to expect those folks to get sober while they're living under a bridge, to get control of the voices in their head while they're sleeping on a park bench.
Dan Strawn is the executive director for the Homeless Alliance. The Alliance is placing homeless people in housing where they can access services they need, like substance abuse or mental health treatment.
The demand has been so pent up for so long in Oklahoma City that in January and February, instead of housing 14 people, we housed 49 people.
Strawn says one person they recently placed in housing was a homeless man who slept on the porch of this burned-out house. The man has suffered 2 strokes, has brain damage, and can't hear or speak well.
He's incontinent of bowel and bladder. This is absolutely no excuse for a guy like that to live and die on the streets of this community.
The Oklahoma Health Equity Campaign is a project administered by the state health department. Its mission includes educating people about the root causes of poverty and poor health. Jeff Hamilton is the chairman.
Our efforts include making people aware, that place matters, where you live matters, and what access you have matters.
Marisa New coordinates the program for the state health department.
I think a lot of people don't realize that we don't have a dedicated funding source for public transportation.
The task of improving the well-being of Oklahomans is complicated, but those in government and the private sector agree the focus must be on breaking the barriers that keep citizens from being healthy.